We begin with a COVID-19 surge in Cebu City, which has crippled its healthcare system. Our correspondent Annie Perez now joins us with the latest. Annie, what more can you tell us?
Patients outside this big hospital in Cebu City were already lining up by the sidewalk, and some of them are inside their cars with oxygen tanks attached to them. According to Cebu City Councilor Dave Tumulak, who responded last night, these are patients who are waiting to be admitted inside the hospital, who are waiting for vacancies and also awaiting their swab test results. Not all of them are confirmed positive COVID patients, but they are complaining that they are having a difficulty in breathing. Today, Carmina, we visited the area and we saw that tents have been put up by the city government along the street near the hospitals. Actually, that area last night where we saw the situation of the patients, a lot of hospitals are around that area. Today, we saw tents and personnel from the city government manning and guarding, making sure that there would be any distractions so that health personnel can properly attend to these patients while there are still no rooms inside the hospital. We checked the DOH tracker this morning, and Cebu City and Cebu province in general, its healthcare facilities are up to 60% now, which means 8 of it are already reaching its critical capacity, meaning more patients are coming in because of COVID-19. And around also the area of the hospitals, we saw that oxygen tanks are being sold, and some of the family members of these COVID-positive patients are rushing to buy hospital oxygen tanks. We asked them that they need the oxygen tanks, especially for those patients who do not have a room yet in the hospital. The city government, who also visited the area, said that they are making sure that there is no hoarding and no increase of prices for the oxygen tanks, as it is an essential now in this pandemic. And on day 2 of the modified enhanced community quarantine here in Cebu City, along with Mandaue City and Lapu-Lapu City, there aren't much changes except for a few vehicles now flying the streets, but some businesses opted to remain open, but only with 50% capacity. And we're still hearing now from the Cebu City government as they are continuing making updates on how they're going to implement this MECQ and how they can help decongest the hospitals now, which is the major concern in this situation with the virus. Carmina.
Yes, Annie, a couple of questions for you before we let you go. The oxygen cylinder supply, you touched on that in your report. Is there enough supply there in Cebu?
We asked the owners of the pharmacies who were selling the oxygen tanks earlier, Carmina. They assured that there are enough oxygen tanks for the patients. And in case if they run out of supply, we are hearing also help from other government officials. Like in Naga City and San Fernando in southern Cebu, they also said that there's a plant there that can help supply oxygen and refill tanks in case there's a shortage in the city. So we're seeing now how the different agencies and the stakeholders are trying to hold hands and help one another with whatever they, especially in this situation. It feels like it is the round 2 of what Cebu and Cebu City encountered last year when we had a double ECQ, and the health sector is looking into this new quarantine classification as a breather for them so that they can take time and decongest the hospitals, as what is very evident now here in the streets and the cities of Cebu. Camina.
Annie, you were correct in saying that this is not the first time that the province and the city is experiencing a surge. What can you tell us about the difference between last year's surge and this time around, Annie?
Actually, city officials are saying it's harder to control the situation right now because with modified enhanced community quarantine coming from MGCQ, there's loose restrictions and people are enjoying the liberty and their freedom to move around. And actually, with the implementation of MECQ, there is no border control between the Tri-Cities and Cebu province, which means, unlike before, during ECQ, only residents specific to their area and locales, they're only allowed to move there. But this time, we are allowed to move from one city and from one town to another. So movement is very loose here, and that's what's making it's very difficult for them to control the people who are moving in and out of the different places. And that's why they're also looking into these is one of the reasons why there's a surge apart from the Delta variant that was announced last week by the Department of Health. In fact, Central Visayas logged the most number of cases the last time DOH announced the breakdown for the regions who had the Delta variant. So they're trying now not to control people as they have a lot of economic activities going on, but they're trying to train the business establishments and the public transport to make sure that all protocols are in place to lessen the transmission. Karina.
You touched on the oxygen supply a while ago. I want to focus now on the COVID-19 treatment drugs currently in stock in hospitals. How is that coming along? Are you still good with supply when you talk to hospitals? Annie?
The pharmaceutical companies here that we talked earlier said there is still enough supply, but the city government is already calling for donations and for help to the specific drugs. They mentioned remdesivir and ivermectin. If those companies or individuals who have extra of these to maybe store and back up in case there will be really a shortage now in the city. But as we checked earlier, it's still in place. We saw a lot of people lining up and they were still given the drugs that were prescribed to them. But just as precaution and just to prepare, they're already asking now as form of donation these specific drugs to help treat COVID-19 patients here in Cebu.
And lastly, Annie, talk to us about manpower. Our healthcare professionals, go ahead.
Well, a lot of nurses here and medical personnel already resigned, especially in the private hospitals, Carmina. But the Department of Health have augmented and has immediately hired to aid in those hospitals where these nurses have resigned. Last week, we got a number. It's about 66 nurses that the Department of Health has hired and it has been deployed to the different COVID-19 hospitals. Today, we are yet to get another number. And even the city government also said that they have been posting immediate hiring with a salary above average for nurses for just a short period of time just to help in this COVID-19 pandemic. So in a nutshell, we can say that they are trying to cope up with the loss that they had over the series of resignations in the different hospitals. And we're trying to get a word from DOH if they're also wanting to ask help from other regions for medical personnel. But as of the moment, and as we speak yet, there is still no advice. But they're floating the idea, just like how Region 7 augmented other regions when they were in need of help during the response to this pandemic. Selena.
Thanks a lot. Our correspondent there, Annie Perez, joining us on the line from Cebu City. Annie, you take care. Keep safe.